we are looking at the prenatal screening, and this is of the Down syndrome. So before we begin, the question is, what is comment on the maternal serum markers? So basically, what is increased and decreased? So in this video, we'll find out these answers and learn more in detail regarding this. So firstly, we'll look at the USG findings. This is all in case of the prenatal screening of the Down syndrome. So what are the USG findings of this? So USG findings, there is something known as the intrauterine. There is intrauterine growth restriction. So this is nothing but the IUGR. So decreased blood flow, and there is decreased blood flow. This is IUGR. And then there is also presence of the choroid plexus cyst. So there is a choroid plexus cyst. And next there is also the increased nuchal translucency, that is the NT, that is greater than the 3 mm. Next there is also the hypoplastic nasal bone which is present. And there is also the congenital heart defects. There's congenital heart defects. There is also the increased interstitial echo, increased intestinal echogenicity. So just to recap, we saw the USG findings in case of the Down syndrome prenatal screening. Firstly, there is the IUGR, that is the intrauterine growth restriction, which is nothing but the decrease in the blood flow. Then there is also the choroidal plexus cyst which is present. Then there is increase in the nuchal translucency, that is it is greater than 3 mm. There is also the hypoplastic nasal bones. There is a congenital heart defects as well as increase in the intestinal echogenicity. So to continue with other features of the USG also includes the presence of the duodenal atresia. There is duodenal atresia. And next we'll move on to the maternal serum markers. The maternal serum markers. So under the maternal serum markers, we'll look at two categories, broad categories, that is in terms of decreased the maternal serum markers. So decreased, it includes the AFP. So what is the AFP? Is nothing but the alpha. This alpha fetoprotein. So this is nothing but the AFP. So alpha fetoprotein. And next comes the unconjugated. There is unconjugated estriol. This unconjugated estriol. Then there is also the PAPPA. So what does this PAPPA stand for? So this stands for the pregnancy. There is pregnancy associated plasma protein. And this is A. So in short, it is known as the PAPPA. And looking at what is increased. So this was decreased, now it is increased. Increased is the HCG. HCG is nothing but the human chorionic gonadotropin. And then there is also presence of the inhibin. There is inhibin. Then there is also the neutrophil. There is also the neutrophil alkaline phosphatase. There is phosphatase. So just to recap, we saw some USG findings and we were left out with there's also duodenal atresia which was seen in the USG finding. And now when we move on to the maternal serum markers, we need to know that there are some things which increase, there is decrease as well as increase. So what does it decreases? So decrease in the AFP. AFP stands for the alpha fetoprotein, as well as there's decrease in AFP, alpha fetoprotein, there's unconjugated estriol also is decreased, as well as the PAPPA is also decreased. And so the PAPPA, the full form is nothing but it is a pregnancy associated plasma protein A. Next we see what is increased. So the increase in the maternal serum markers is nothing but there is HCG which is increased, as well as there is inhibin which is increased, as well as a neutrophil alkaline phosphatase. This is also increased. Next we'll move on to the other features, that is there is amniocentesis. There is amniocentesis. So what happens in amniocentesis? Amniocentesis, there is a 14th to 18th week. So there is 14th to 18th week of the pregnancy. And next we look at the chorionic villus sampling. So under the chorionic villus sampling, there is a 10th to the 12th week. There is a 10th to the 12th week of the pregnancy, and this gives the diagnosis in the first trimester. Gives diagnosis in the first trimester. So to recap, we saw about the amniocentesis. This takes place in the 14th to 18th week of the pregnancy. Then we also saw the chorionic villus sampling, which takes place in the 10th to 12th, the 10th to 12th week of the pregnancy, and it gives the diagnosis in the first trimester. Now we'll be looking at the question we asked. So initially the question we asked was comment on the maternal serum markers. So this was the question, the maternal serum markers. So looking at the maternal serum markers, we need to know there are some things which decrease and some things which increase. So what is the thing that decreases? Decreases is the AFP. So AFP is nothing but alpha fetoprotein, and then there is also the unconjugated. There's unconjugated estriol, and then there is also the PA-PPA. So what is the PA-PPA? It is nothing but the pregnancy associated plasma protein A. Then we'll look at what is increased. So increase in the HCG. HCG, the human chorionic gonadotropin, as well as the inhibin. So inhibin is also increased, and then the neutrophil alkaline phosphatase. There is also the neutrophil. There is a neutrophil alkaline phosphatase. Just to recap, we saw the maternal serum markers. This was the question we asked. So there is a decrease as well as increased. So what decreases is the AFP, unconjugated estriol, as well as the PA-PPA, that is the pregnancy associated plasma protein A. And then what is increased? Increase in the HCG. HCG is a human chorionic gonadotropin, as well as inhibin, and the neutrophil also increases, as well as the neutrophil alkaline phosphatase. So this was about the prenatal screening in the Down syndrome. To learn and grow daily, please do subscribe.